Assalamualaikum warahmatullahi wabarakatuh and greetings. This is Ifat bin Kasim. My group consists of Ifat bin Kasim, Muhammad Zulfikri bin Abdullah, Ting Mai Hui, Shirin Chong Ze Suen, Kwan Chai Chi, and Sebastian Anak Stanley. Today our group will be Today our group will present about the market structure and price behavior around the healthcare industry. First and foremost, it is important to understand that the healthcare industry in Malaysia is huge and can be divided into three parts. These three parts are public hospitals, and private clinics. They are different but still represent our country's healthcare industry. Today we are going to look into the different market structures and price behaviors of the industry, different parts of our healthcare industry. Number one is public hospitals. Public hospitals are the general public of Malaysia and governed by the government. This is why its market structure is monopoly. Only the government are able to administrate them. This means that nobody else is able to do anything about public hospitals other than the government of Malaysia. This fits the government's need to take care of its people wellness and well-being. The treatment costs are subsidized and have wide range of healthcare services. The second part is the private hospitals. The market structure of private hospitals is oligopoly because the private hospitals are huge hospitals chain that there are only few choice in the market. It means that there are not so many private hospitals are available in Malaysia for the patients. This industry also have high barrier of entry due to its massive cost to build. This cost makes it hard for new competitors to enter the market. The third section of our healthcare industry is private clinics. These clinics are in a monopolistic competition market because people are able to open clinics to treat different diseases in large numbers. For example, people are able to open their own private clinics like dental clinics. However, it is also important to remember that this sector of healthcare industry can be hugely different from each other. These clinics may provide different services based on its specialty. This includes dermatology, pathology, dental, and many more. Due to the government as the only power to control the public hospitals, they become the sole price makers in the industry. However, in Malaysia, the public hospitals has usually lower price than private hospitals. This is because, as mentioned, it is the government's goals to ensure its people well-being and wellness. It is important for them to make sure that such its people medical need is being attended and easily accessible. The price behavior of the second market structure, which is private hospitals, is a lot different from the uh, public hospitals. This is because the market structure has limited competition. They may set prices, whether together or under a leadership of one of the companies. They tend, they tend to set higher price due to the high cost of maintaining such business. This includes the cost of its staff, medical supplies, and machines, as well as the infrastructure maintenance. It is common for us to see high prices for the services due to its unsubsidized cost. For private clinics, their price can be high as well. This is because even though it is a lot easier for other firms to enter this market, they have product differentiations, which is different health services for different health issues. This this includes dental, cosmetic, dermatology, neurology, and pathology. The price depends on the different type of medical services but may fall due to increasing number of firms into the market. That being said, the more clinics we have, the frequent the price of products will change. Now let's talk about social costs. Social cost is a cost that happen to third parties that is not involved in the transaction between buyer and seller such as citizens. The example of such situation is for people living nearby hospitals that are affected by surrounding of the hospitals. The most common issues that are faced by people living nearby the hospitals are congestion. It can be difficult for them to move around, especially when medical emergency happens. At the same time, due to being stuck in the traffic, they can also be exposed to air pollution. When we are talking about government policies that can affect the healthcare industry, one of them is a subsidized public healthcare. The subsidized public healthcare is when the government is charging free or very low price for healthcare services. This usually attracts a lot of low and middle income citizens to go to public hospital instead of the private hospitals or clinics. However, due to huge capacity of the patient on public hospitals, it is important for the government to focus more on our strength healthcare system. Our government has also been promoting medical tourism to other countries. Our country has been well known as the country that provides very good healthcare with reasonable prices. This attract a lot of other foreign patients to come to Malaysia and get their treatment. These countries include Indonesia, United States of America, and Singapore. It is very common to hear that the prices of healthcare service in their country can be very high. This is why our country has been promoting medical tourism and founding Malaysia Healthcare Travel Council in 2009 to promote and enhance the medical tourism. Lastly, our government has also done a lot of public health initiatives. Our government has been announcing a lot of health campaigns that focus on prevention and diseases like obesity and diabetes. This will increase the awareness of the citizen regarding health issues. When they are aware of such things, they are more likely to be vigilant in preventing themselves from getting any kind of diseases. This will later increase the number of people trying to get help in either public or private hospitals. I think that is all from us. Thank you for your attention. See you later.